Okay, good afternoon, everybody. I'd like to call to order the Cabarrus County Board of Commissioners for our fall retreat. We have a number of good items to cover today. I'm glad that all of you are here. We got a lot of extra chairs and a lot of extra people. First thing we're going to do is talk about human services and the federal government shutdown, get an update from what we heard on Monday. So.
Sorry. Okay, good afternoon, everybody. We are glad to come back to you and give you some updates. We have quite a few and definitely are in need of guidance from you as our governing board regarding direction that we go. I want to first start, before we get into some of the funding streams that we were talking about Monday night, we need to cover a situation that has developed late yesterday to get your guidance on as well. The Work First program, which Chris is probably more familiar with it, but that was the program that was developed by the state under welfare reform in 1996, which basically provides cash assistance to eligible clients and provides work support services to them to help get them employed. The state announced late yesterday, and we have nothing official in writing as of this point, but they announced yesterday that they were suspending the Work First program for the state until federal funds were going to be released, which is covered under the Temporary Assistance for Needy Families grant. And that is one of the grants that we have in the information and that we did talk about Monday night. So with that, we have basically started to implement a suspension of services in that area that will be effective Friday at 5 p.m. That will include Work First Employment Services, which is now currently administered by 2 social workers. It will include Work First 200% program and the Work First Emergency Assistance Program, which is administered by a small staff of 3 people that's within Kathy Mauer's area. So where we need guidance from is basically, since this program is going to be suspended effective Friday, we have 4 staff that we have calculated that are impacted by this decision by the state. And we need guidance on where to place these staff during this time when we basically will not be delivering these services from the state. We would like to request that they be reallocated to the economic services area that does still have funding at this point. That could change any day now too, the way things seem to go. But at this point, we still have funding in that area, and as you know, we have need. So we have 4 staff that we would like to reallocate to that area from Work First, probably effective Monday morning at 8 a.m. Outside of that, obviously, the issue of furloughs are there as well too. We would prefer not to furlough staff if we don't have to. However, we understand that is a reality that we may face and seek your guidance on this, since this is a situation that's basically developed. I mean, it came as quick as could be, and counties have started to work today to determine what to do. A lot of counties, from the little feedback I've gotten, a lot of counties are basically taking this action because the biggest thing we can do here, since the state is basically suspending the services, is this program right now is basically funded at this point with county dollars anyway. It's called Maintenance of Effort Funds, MOE, and we have to meet that MOE requirement before we can draw down the federal funds that are available. So what we can do is start to use those MOE funds to help in the child welfare area, which of course has impacts as well too from the funding. But child welfare is a critical safety sensitive service that we need to keep going. So we would basically look to reshift those funds, what we could, to child welfare. But that's kind of the status that we're in right now. So we would seek your guidance. Our recommendation would be to reallocate so that we could keep staff employed and keep them going. But we do seek your guidance, and we'll try to answer questions as best you can. Understand we only have this information from a conference call at this point.
Just to add to what Ms. Rose just said, was in the Work First program, it is MOE, it's maintenance of efforts, so it's 100% county dollars. If we reallocate them over to economic services, you would put them working on the NC-FAST and
right, all Medicaid, food stamps, yes.
So if we do that, then we can pull down, and then it would be 50-50. We could So we would only be paying 50% of their salary with local funds. The other option, again, would be the furlough, or lay them off until the funds start coming back through. So those are your options. I did want to let you know that reallocation is a good choice, but it still includes local money.
So is this like the other things that we're discussing? We think, we hope that we'll be reimbursed for that once this is over. I know we can't guarantee anything, but is that our expectation?
Well, yes and no, because right now, this program is funded with county dollars. And basically, again, what the state is doing is they're saying some counties meet their maintenance of effort very early. So the state is basically saying we do not have access to the federal funds. So counties that are submitting for federal reimbursement under this program, we do not have those funds to give. Therefore, we are stopping the program. And another component of this program is the cash assistance, which is basically when a person comes in to qualify for this program, they receive cash assistance, but they do have to work for that cash assistance. The state has announced that they, and of course this is unofficial at this point, I will preface that, we have nothing in writing, but their statement is they cannot continue those cash assistance payments into November. So if you're not making the cash assistance payments, you can't make the client go do 30 hours of work per week because they're not going to get paid. So that's why the program is being suspended from the state perspective. But right now, this program is funded right now primarily with maintenance of effort dollars because we have to spend about $1.2 million before we can draw down that $1.5 million that's available to us from the federal government.
Right.
So that's kind of the quagmire that it is.
Yeah, so what you're proposing still suspends the program.
Correct.
Just keeps those staff people on board and
Correct.
takes care of them.
That would be our recommendation. We
Right.
have needs in economic services. We as you know, we have a lot of needs in economic services.
Might have
especially-
more.
And it may have more, correct.
Yeah.
The slow trickle may, with, we're going to probably see increases in child welfare from this as well, too. It again, should this continue long-term.
Right.
But, we would like to, we feel like we could use these staff in other areas to help us and continue to help us with that situation. But again, we understand that, there's still county expense in that. That's why we seek your guidance.
So the expense number really won't change. It's just what they're doing.
Temporarily, it would not change, correct.
Yeah.
Now, be aware that, down the road, if the program was working normally, down the road, they could be claiming federal dollars. But
Right.
at this point, since cash assistance may be threatened, there's no reason to have employees or clients doing these services when they may not themselves get paid in November if this was to continue.
Thank you.
Ms. Rose, so my understanding is that we have to pay these MOE dollars first, about 1.2 million.
Mm-hmm.
And so it sounds like about 50% of your budget comes from MOE and 50% comes from federal reimbursement, a little bit greater from federal reimbursement.
A little bit,
Yeah.
correct.
So we're in October, so we've still got 6 months of the year before we get to the halfway point. Or not 6 months, we've got until December 31st until we get to the halfway point. Wouldn't we be spending county money through probably the beginning of December anyway?
Yes, most likely. Usually, our maintenance of effort, we typically, historically, we've met that in February, March timeframe, and then we start to pull down the federal dollars. It depends, on the client's services and so forth.
Are they not going to count the dollars spent during this period as part of our MOE? Are those getting excluded?
No, they could be counted, but the difference here is that when we provide the employment services, those clients are working for their cash assistance benefit that they're getting. The state is stating that they will not be able to pay the cash assistance, which comes out of their pocket. They're not going to be able to pay the cash assistance after probably October 15th, November 1st. So if they're not paying that, we cannot require the client to do the employment services. So that's why the state has basically suspended the program. Does that make sense?
There's two components of it then, one part that we pay out of our MOE and one part that the state pays.
Correct. The cash assistance part is not in our budget. They pay that out of the federal monies that they get. And that is a monthly check that, again, the client does work for that check. So since if they can't make that check, we can't make the client go do the activities that are required. So that's why we were suspended.
And your proposal then is to shut down both components of the program and reallocate the staff resources for a short period of time?
Right, until the state releases the program back. That's correct.
Thank you.
Anybody else?
Have the temporary workers in the Economic Services Department been hired and?
Yes, they have.
Okay. How many was that?
We have 10 up and going.
10?
We had
Yeah.
10, we had 7 for 3 weeks. And then the other 3 came on shortly after. So I think they've only been there a week and a half or so.
Okay. Have you seen results from, that week? Is it?
We have, our initial numbers that we projected that they could output due to training time and just learning the system was not as high as we expected, but they are producing and moving us right along. So we're feeling good about what they're doing. Are we out of our hole yet? No, but they are producing.
Okay.
What's the amount of funds you talking about coming from the state?
In terms of the TANF program?
Yeah,
Well, the monies actually are federal. The state has no money.
but
in
the
work-
state's sending it to the county,
The
right?
state is a pass-through, that's
So,
correct.
in other words, you're not getting it because of the federal government.
Correct. They're not getting their federal money.
But how much money are we talking about?
Well, the federal match to the Work First Block Grant is approximately 1.5 million and change that we would be able to pull down once we met our MOE.
But you hadn't got to that point yet to pull
No,
in
we're
the
not
money
down
down.
to that point. Again, the state shutdown is based on the fact that they may not be able to make cash assistance payments, and therefore, we cannot do the employment side of it.
What is the average cash assistance payment to each individual?
Last figure I heard was about $234
A week?
Well, no.
a month.
A month?
Most of our cases are what we call child-only, and their payment is $181. If you have a household of 2, then it goes up to $236, and it's an incremental increase like that. So it's not a huge amount of money per family that you're talking about, and that is per month.
But they have to work 30 hours a week to get that?
Not the child-only
Not the
cases,
child-only.
but the ones that are parent-included cases.
Has to work 30 hours a week?
Or they have to work enough to meet when you divide the minimum wage into their check amount. So whatever that is. So if they're
Oh,
getting
okay.
$236 a month, then you would divide, $725 into that, and that would be their hour requirement. And it would
Okay.
be work experience or actual work, volunteering, and Kathy can speak to some of the sites that those folks participate in.
Okay, thank you.
One of the things that we went through in our board meeting for September was the training process for your temps and things like that when we were talking about bringing them in to help with the FAST system. I think we had talked about the fact that it takes 3 to 5 days to train a temp. If we move the employees from this program that you're talking about over to the NC FAST and they start inputting, they're going to have a week's worth of training, and then by that time, this is probably going to be over. And
Well, there's a little difference with these folks because some of these folks, not all, but some have worked in that system before. So we could actually use a lot of them to do intake, which would be actually taking applications. There would be training, some training, obviously, but it's different than hiring someone that's off the street that has no knowledge of our system. A lot of these individuals have worked in our system before, so we could use them at a little higher level even in some degree.
they've worked in the NC FAST system.
They've worked in the program, the public assistance program. Now,
Well-
maybe not NC FAST, but
Well, they
one has
have.
been trained, yeah.
The social workers in the Work First Employment
they have been
area,
trained.
their roles are in NC FAST, and they went through the state-provided NC FAST training that happened last month. So they're fully capable and working now in their role in NC FAST. We've got 3 employees who are being trained right now by their supervisors. So they would be up to speed in a matter of days to do what's needed.
Does anybody have a recommendation or a preference? I mean, I think that we should take care of the staff if we can, and if they have work for them, then let's keep them working. But I don't
So
know
do
what
we
the
need
rest
to
of you think.
suspend the rules to
I think you want guidance. I don't know that we
He'll
do.
just give us
We just
guidance
need to have
on
guidance. I don't
making
think we
Okay.
don't have to make a formal vote. We need
Well, I
to know
certainly
what
would-
we would do.
Would recommend that we follow Mr. Rose's recommendation and take care of the staff and make the best of a bad situation.
I'm not opposed to that singular action. I would personally like to get a more comprehensive idea of what all of our services are doing today, and then go through on a case-by-case basis. Maybe that we just have limited dollars, and Mr. Rose is first, and I feel like that this is a good idea, but, you know, we may not have the ability to do all of these programs, and I'd really like to see what all the programs are before I make a decision on any singular program.
You are referring to all the human services programs that we're talking about that's impacted, right?
Yes, I am.
Okay, sure.
I agree. I agree with that. I don't know if there's if we could do that at the end or after we hear. Okay.
We can progress and then start to update you on the other
Right.
programs.
Okay.
I think the best way to conduct this is, of course, I have a lot of people up here because they're a lot more knowledgeable in some ways than I am. I know a little bit about a lot of things, but these folks know a lot about the program, so they're here to help answer questions. I believe the first.
Ben, hold on one
Yeah,
second.
I'm sorry.
In your booklet, there's some inserts that have a summary sheets that they're going to be discussing that might make it helpful for you to have in front of you.
Yes, I have a lot of paper here, so forgive me if I'm going through papers. I believe the first, one of the most pressing issues that we have would be the child daycare program. We did send you some information regarding the child daycare program and what we're facing with that, and we talked a little bit about that on Monday night and what some counties have been doing. Child daycare basically is a federal program for the most part. There are some state dollars in the non-Smart Start subsidy that we get, but for the most part, it's a federal program. So those funds are not available to us effective in October, though, if I understand correctly, the state was assessing still to see if there might be some funds. But at this point, we're operating on the assumption there are no funds available to reimburse us for October expenses in November. We are projecting to spend in October in the child daycare program approximately $340,000, I believe. That is subsidy and administration. That's money that we would not get back on reimbursement. Normally, we would have that expense and we would get that in reimbursement. So we will not get that in reimbursement should this issue continue. So that's our projected October expense in daycare. The subsidy itself actually provides us, if you take the whole subsidy and divide it by 12, basically we can spend over $400,000 a month in the child daycare program. While we're under that a little bit right now in October is because we did not receive our funding authorization for daycare funds until September. And when you had the transition back from summer to school, we started to dip a little bit in our expenses because we were nervous to add children to the program without knowing what our monies were going to be. And we were working again with an assumption they were going to be cut. However, when we got the funding authorization, they were actually a little bit higher than we expected. And I'm still trying to figure out how that happened, but they were. So we actually started to add children in September. And we actually added 70 children, I believe, in September to the program. However, we now get hit with the shutdown, and that's why we're still spending a little bit under the allocation that we have, but that's our projected expense for October. Daycare is a very important service. There are about 3 components, I think, that are critical to it. I think 2 things to really focus on from our standpoint is we do use these funds to provide daycare support services to families and children that are involved in our child welfare system. So if we have a case where there's a child at risk of abuse or neglect, or there's a foster child that's in our custody, we may be using these funds to help support that case, which is a great resource for child welfare. In addition to that, we serve Work First clients. Well, if we have a suspension in our Work First program, they will not be getting daycare going forward. So we will see that expense go away for now with that program because we won't be having that need for that daycare since they will not be doing their work. The other population that we serve in this program is basically working families. Last year, Chris was a part of this, we actually did a reduction of services plan with our Board of Social Services at that time, and the board really wanted to keep the focus on employment, and Chris will probably recall that conversation. So we pretty much focus our services, our subsidy services, on people that are employed. So if we do lose these services, if we suspend these services, those people will have that impact of basically an immediate loss of their daycare support. And just for a footnote, a lot of these parents that do receive these services pay in part for these services. We're not paying for the whole subsidy. It's based on their income, and they will pay a portion of the cost. And again, the notion there is to support work and keep them out of our office on the other side of things as well. Daycare, if we suspended daycare, we could have a ripple effect in child welfare, there's no doubt, with the cases that are especially involved in child welfare. But then on top of that, you might have impacts that, with the other cases. And I think as well, too, you would have economic impact, no doubt, with the centers that do serve a lot of our children. So this is a big decision, and we understand the importance of it. Most counties are still holding tight with the daycare program. They are kind of in a wait-and-see pattern, I think really waiting more for the October 17th date that now has been floated regarding the debt ceiling. But there are about 5 or 6 counties, I believe, that have started to initiate suspension of daycare services. Again, we would recommend keeping the services going through at least October 31st, and then reassess, with the debt ceiling and where we're at with the shutdown, and then evaluate it from there going forward. But right now, we would, recommend that we keep services going, but again, you would be seeing about $340,000 that we would not be receiving reimbursement on should it continue into November. So again, I guess we would seek guidance on that, but we might do that at the end too if you want us to move on. But are there any questions about the child care program and the effects we're seeing there? No? The next service that we would like to address is we've addressed the temporary assistance for needy families. We'll talk about the social services block grant. Social services block grant is a major grant that we receive. It helps us provide a lot of mandated critical core services, both in the adult and aging area and in child welfare. It does cover both. In the child welfare side, basically social services block grant provides funding at 2 levels. We have what's called TANF transferred to SSBG, which gives us a small amount of funding to help us with child welfare services. The bigger amount is what used to be called Child Protective Services expansion. And basically what happened was this was a state pot of money, and we receive over $320,000 in our county to help us provide child protective services with this pot. When the state had its budget crunch in 2011, they basically took out their money and replaced that pot of money with SSBG, which is federal. Therefore, now that we're not getting the funding for SSBG, we have lost access to that funding. And then on Kathy's side, all of Kathy's services in the adult services area, adult protective services, guardianship, adult care home monitoring, adult daycare, all those services SSBG helps support. Basically, her workers, when they provide a service that's covered by SSBG, they will code their time to that, and then we can claim that reimbursement of their salary and fringe for that service that they provided. SSBG is a critical key funding source for very safety-sensitive services. I would really recommend that we not look at cutting back any services in the child welfare or adult services area. I think that would present us a huge liability. I think it would put a lot of stress on workers that are already doing a very difficult job. These services keep disabled adults and children safe from abuse, neglect, and exploitation. And I really believe these are mandated services that are not tied to funding. We still have to provide these services regardless of the funding that's there. It's a federal mandate under the law. So we are very hesitant to make any recommendations for cuts there, but obviously, we would entertain feedback and guidance from you on that. But that would be our recommendation, is to let us maintain those services as they are and try to find savings. We have implemented a hiring freeze and a travel freeze in these areas. So we are trying to cut costs where we can right now. but we need to continue to do child protective service investigations, provide in-home services, investigate adult abuse and neglect, monitor the rest homes, that's our adult care homes, I call them rest homes still. Provide guardianship services. We have many wards that we provide services to. So all these services we have to keep doing. We cannot cut back on the services. So that's kind of where we're at with the SSBG funding. The last one within the DSS, before I'll let Kathy and Randy talk, the low-income energy assistance program is really not having an impact on us yet. That program is not effective till December 1st. So at this point, there's not a lot of issues with that program. So that is one that it's obviously not going to be funded should the shutdown continue. But it's not a program that's of immediate concern right now, so I don't think we really need to cover too much with that. I'll let Kathy talk about Home and Care Community Block Grant, and then we'll let Randy talk about transportation, and then we can go from there.
Good afternoon. Basically, the Home and Community Care Block Grant is the grant that we have available that provides services for those that are 60 or older in our community, and basically for those individuals who do not or cannot receive services through some of the other traditional types of funding sources, such as Medicaid. So what you will find in there is HCCBG does provide funding for adult daycare and adult day health. They also provide us and allow us to do information and assistance, which is connecting seniors to information and resources within the community. It also provides us to do some in-home services, which is providing someone to come in and assist someone with personal care, with a bath, toileting, those types of things. We also have a small, very consumer-directed service program, and that program is also much like your in-home services. It helps for us to provide for someone to be in the home with individuals that are, maybe they have they have MS, they're a quad, they have a lot of those kinds of health issues. With our adult daycare and adult day health, you find a lot of individuals who, because of their family circumstances, they need somewhere for this adult to be during the day so they can continue to support employment. And a lot of our individuals that we are serving have issues of dementia, some cognitive problems, and those services are very vital to those folks to be able to allow their family to continue to work and also have their person to have a safe place to be because they cannot be left alone. We also, the congregate nutrition sites, that's another part of the Home and Community Care Block Grant, and what that does is it provides a nutritious meal for our older adults. At this point, we are serving approximately 30% of low-income adults in our community. It also provides the adults with an opportunity to have some socialization, to not be isolated in their home, but to come out and have interaction with other seniors within the community. We try to be very cost efficient in everything that we do in regards to those programs, but we do feel that those services provide very valuable services for those individuals 60 or over who can't access services through the Medicaid system and therefore don't have the funds to pay privately.
One thing you didn't mention that I think is big is, if I'm not mistaken, we are funded through the end of October.
Yes.
On that.
Mhm.
So
We have our funding
we're sitting
through
there
October
thinking, okay, is the
31st.
clock ticking, not for the month of October.
For Home and Community Care
So it
Block
wouldn't
Grant.
be until November services that we build in December that we'd even have an issue. And I think there's quite a few of us hoping this issue is over with by the end of October. So we do have a little more time to make a
Yes.
decision on that program.
So the program that you mentioned about the nutritious meals, is that the lunch sites that
Yes, it
are
is.
scattered
We have
about?
5 within the county in the different areas of the county. Yes, sir.
Right. I had the opportunity to have lunch with some of the folks that operate some of those sites. The county had an excellent employee appreciation wellness fair last week, and so I got a chance to sit and talk with some of those people. I was very pleased and surprised to hear their level of enthusiasm and the type of activities that they have. By the time we finished that conversation, I almost felt like the socialization piece of it was more important than the nutrition piece of it. But It was very enlightening to hear them talk about the program and the people that participate, so it is important. I agree.
And I would have to commend that staff. We did a event at the Kannapolis Lunch Plus Club site. It was a kind of like a festival, and we had, I think, approximately 225 attendees, and the staff was able to receive sponsorships for everything that they did at no cost to the county. So they are very intent about reducing cost and making sure that if there's some way that they can get donations or sponsorships, they do that, and therefore the participants really enjoy the activities.
Do you have, I didn't see your home block grant on either of these two sheets. Is it listed on here and I'm missing it?
It's
HCCBG.
HCCBG.
Okay.
And in the middle, it says
Great.
good through October 31.
Wonderful, thank you.
Randy? Okay.
Oh,
Randy,
okay.
your turn.
All right. Well, since we came before you last time, as we said, the circumstances change day to day, and we've received information on the 8th in reference from the DOT for our federal grants. And at that time, the indication was that, per our understanding and direction from the Federal Transit Administration, no new funding can be issued to include new contracts. On the 9th, they did come back with reiterating that, but they also added that we are looking at a new initiative and will advise, which at this point, we're not sure what the new initiative is to maybe assist in some type of federal funding. Don't know for sure. We do know that the DOT is processing. They did say they have 2 staff members working, and they are processing the rope applications, which is what we brought before you to get approved for the public hearing, the rope funding. So as they receive those applications, they are going to continue to process that through there. So we will be getting, I'm making the assumption that we're going to be getting that as we go through that process. The two grants that specifically we're looking at that have federal funds tied to it, the first one is the 5316, the JARC grant, and that is the what they call Job Access Reverse Commute. That's where we are helping get individuals to and from workplace. I will remind everyone also that this is the grant that we use to help get the clients to the workshop over off 29. We have individuals there that are gainfully employed, getting the paycheck, and we have routes that are specifically designed to help move those individuals from their homes to the workshop so that they can get a paycheck, and it gives the caregivers and the family members a little respite during the day while they're at work, and then they bring their paychecks home, and they're very proud of that. And we also have this for the general public, where they are actually having an opportunity to use the service as well to get jobs and go back and forth between their home and workplace. It helps keep them gainfully employed. So we feel like it's an excellent program. The other one that we have that's also involved in this that gets federal funding is what we call the 5310 Elderly and Handicap Grant. This is the grant that we actually got this year for the first time. It's expanding so that we were able to actually acquire some new equipment and increase our services for our senior citizens to the meal sites, and also for medical visits and getting to and from the doctor's offices and taking care of those issues, along with quality of life issues, basically additional things to go to the pharmacies and to the grocery stores and those of that nature. So we were able to expand some of those services, giving that grant. We also utilized in this grant, we were able to create the match that was required, came from partially from the HCCGB money that we received, and also from our rope money. We were able to pool some of those resources together and utilize that as the match so that no local county dollars were used in that match process. So those are the two programs that we have that would be impacted by this funding cutoff.
And just one little follow-up note. Right now, the funding streams that we have talked to you about, again, most of these are federal grants, and the impact is right now are into November. At this point, other funding streams for us within the human services field, such as the public assistance, administrative monies, and the monies for the food stamp and Medicaid program, child support, those programs have not been impacted yet. Should this shutdown continue, we could potentially see impacts there as well, too. There has already been discussion, I think there's been states that have already been talking about, can they continue if the federal government will not fund the SNAP program into November and December should it extend? Could there be potential cuts even in the food stamp program that we're behind in to begin with? So right now, these grants are the biggest impact. Should this linger for a long period of time, we could be seeing impacts throughout the whole agency. It just depends on where things get to with the federal side. But it's primarily the grants that are impacting this right now.
In the second page is what you're requesting to continue through the end of the month.
This is our projected, basically what this is really, it's what we will not get in reimbursement in November for October.
Right.
This is what we're projecting we will spend. You have to realize, most of our services, we upfront the money anyway. So we're spending it, we have the expense budgeted, but then we get the reimbursement. So this is what we're projecting that we may not get reimbursement on for October services that would be billed in November, should this issue not be resolved.
So if we decide that we want to continue all of these services through the month of October, should this situation be resolved, which I certainly hope that it will be, there will not actually be any additional cash outlay for us during October. We just run the risk
Correct.
of having it in November.
Correct. We're a reimbursement system, that's correct.
Right, so that leaves open the possibility that if we haven't had a resolution to this by October 30th, we can all hop on a bus and go to Washington and talk to them and get it straightened out. Right?
Yeah. When this has come up in the past, typically, once the issue has been resolved and there's either a continuing resolution in place or the budget's been adopted at the federal level, these are all, they go back to the very beginning and they catch you back up. Right now, and typically that's probably what's going to happen now. However, there's been a couple of statements from different officials at different levels that we're not sure if that will happen this way or not, or if we'll just pick up once we sign it. So I think from the last conversation we had with the state was that they would actually have to go to the effort of changing that policy to not make it retroactive. So the problem is, we hear the comments, and we're not getting anything in writing saying, yes, we're going to make this retroactive.
Right.
So that's why we want to make sure it's in front of you guys, that there is some exposure, and this is the amount. So that's where we're at. We're waiting on, we have a couple of our staff people are getting ready to listen in on the county commissioners conference call here in about 15 minutes. Hopefully it'll be updated. Maybe they've got something in writing, but we don't know. But that's the biggest thing. We want to make sure, first of all, understand the impacts to the programs, but then also, just for the month of October, if you choose to continue on, you're right, we are going to put this cash out anyway for cash flow purposes. We just have, we're exposed with that risk of not being reimbursed.
And that, you know, I don't want it to appear that I'm being quick to judgment, because I've had some conversations with Mr. Rose. I've had some conversations with Ann Benfield regarding the daycare situation, as well as communication with some of the individual daycare providers, which I think all of you have received emails as well. But we are, if we do not, I am in favor of funding through the end of October and continuing on as we are now. I think that that our exposure and our risk is not terribly great. Hopefully this will be resolved by then, and it will have no impact on our budget whatsoever. In the event that it does, we have reserves that are, in my opinion, the same reason we have personal savings account, to deal with emergencies. If we suspend any of these programs And we could probably spend the rest of the afternoon talking about the merits of each individual program, which I don't think this is the time to do that. We're going to create a great deal of havoc in personal lives as well as in our local economy. You know, when we're talking about the employment that will be impacted by the employees of the daycare centers, the employees that will have to suspend their work and perhaps lose their job for transportation issues, et cetera. It's a snowball that continues to build. So I think that we should continue through the end of October, and if this is not resolved, then reevaluate at that time.
Mike, my biggest concern about all of these programs is the WIC program through the Cabarrus Health Alliance, and my understanding from the newspapers that program was terminated. Okay, wonderful. I had not seen Dr. Pilkington here, so I wanted to make sure that was addressed.
He is a very able substitute.
Thank you.
Pam will turn your mic on.
The support and the services are still there. It's just that we cannot issue the vouchers, and so that's what the state has suspended. So our staff is still in place. We're still making appointments. Patients are still coming. It's just that they do not have any instruments to cash in. Can you hear me?
Isn't that the point of the program?
Yes.
Instruments to cash in?
That's kind of our thought too. And our biggest concern, and I'm sure Dr. Pilkington shared that with you on Monday, you know, this is almost a $10,000 impact on the per month on the grocery stores, because that's what they rely on, you know, for payment. But we are told that we can continue the program through the end of October, and I'm hearing what they're saying as far as, you know, you can wait and make the decision at the end of the month whether you continue that staffing. Well, next Friday is the first day of the first pay period for November. So we're already, through next Thursday, we will have already encompassed our entire cost for the month of October as far as personnel, which runs 80-85% of your cost. So we're trying to look at it on a daily basis as well, have heard nothing else from the state. We're the only state that they have taken away the issuance of the vouchers, and they cannot tell us why. They cannot give us the legislative reason why they've done that. We're the only state.
Do what?
We're the only state?
We're the only state. South Carolina was told that they can issue through the end of October, but North Carolina is the only state.
Did I hear you correctly that you said the personnel was 85% of the cost of the program?
Between 80 and 85%.
Is it possible that, well, I mean, if we're not giving the vouchers, then we may not need all of those employees, and could we potentially cut back on some of the employees to fund the vouchers?
Yes, we have thought about that. What they have asked us to do is to continue the appointments, just like always, have everyone continue to come in. They still do the eligibility, so they go through the whole process. It's just that they do not hand them anything. And the purpose of doing that is so that we don't have anybody on a waiting list when we try to catch up. And so that's why the staff is still in place. But by all means, if there were a decrease in the number of patients that were coming in for their appointments, we would definitely cut back staff. But we haven't seen any cuts thus far. And yesterday was the first day.
And how much does that program cost per month?
And it's 100% federally funded,
Mhm.
and it's $77,000 a month.
Okay. Mike, I think that I think this is going to get resolved by the 17th. I mean, if you watch how the government works, I really can't imagine that we're going to not raise the debt ceiling. I think this is a big negotiation, and this government in particular, between this Congress and this administration, works together. They are deadline oriented, and they do seem to find the deadlines, and that's a big deadline for them. What concerns me is that Mr. Rose had said the last time that we were here on Monday night that there's a 10-day process and things like that to shut some of these programs down. I would like to fund the program. I think what will end up happening is if we fund them through the next week, we will get reimbursed, and the programs will just go on as though nothing had happened. My concern is that if for whatever reason they don't reach an agreement, that we are sitting here 10 days from now in the same situation where we've still got 10 more days where we've got to shut it down. And so,
We can address that, actually. The state has recommended if you take action, and we're pretty much talking about the child care program in that standpoint. That was the 10-day notice. The state has recommended that if counties decide to suspend daycare, that you can do an immediate suspension. And that's actually preferable over a 10-day notice, because basically if you do a 10-day notice, you're terminating the client and the family from the program, where if you do a suspension, you're just suspending the program. So when the issue was resolved, we could bring it back pretty much immediately, and it would be a less of an administrative headache as well. So the state has given us guidance on that, because on Monday, we were not sure that we could even do that. That question was just starting to be asked. But they have, in fact, they have recommended that should we need to do that with childcare, we could do an immediate suspension of the program, and it would not take 10 days. It could be 1 day.
And we've recommended internally that if by October 17th, we don't have a decision, we issue suspension notices. That would be effective November 1st, depending on what, if anything, the county chose to fund outside of. And we had some recommendations of beyond October, what we would recommend funding if the shutdown continued. And we had just a core group of children that we would recommend getting services, those in Child Protective Services. And we've already evaluated the costs associated with that and the staffing that would be required. So we are moving beyond October, but right now we're just trying to get those children served in October.
yeah, I think my preference is to have suspension notices for maybe, I think October the 17th, I checked, is a Thursday, for Friday the 18th. With the understanding that my suspicion is that everything's going to continue on, but I don't want to be in a position where on Friday the 18th, we've kicked the can down the road for 2 weeks, and now we're looking at a November the 1st, and we're stuck funding all of these programs at 100% level for the next 2 weeks. I think that a lot of these programs are worthwhile, and we should fund at least parts of them, but I think that we can carve out parts that are really necessary. For instance, on JARC, I think we can take care of the elderly people and the disabled people, and maybe not the rural people that really have no disability or inability to go anywhere other than they live in the country. I would, that's what I'd like to do, and I can really work on putting that into a motion, but basically I think that these programs are going to work sufficiently through it. I think our timeline is essentially that these programs will continue on uninterrupted, and the federal government will come back and start funding these programs, but I would like to have a fallback that protects the county.
Just understand, your recommendation is to fund through the 17th, where Mr. Moore said the 31st. I just want to, okay?
That's right. That's right. I would not be opposed to funding some programs through the 31st, but I don't believe we should fund all programs through the 31st.
Well, just as I was coming down the road a while ago, coming over here, the Speaker of the House was on the news talking about him and the President had came to some kind of an agreement. Now, what they agreed on, I don't have no idea, but I think they're going to settle this thing within the next couple of days.
As you guys are deciding about, particularly that my focus today is more about the daycare program, I wanted to share with you that while I understand the county implications, but the families that we are currently serving on daycare are working 30 hours or more a week, and so the impacts to them, if we propose shutdown of the program, could be that they lose their jobs. So
I guess that's my concern. If we issue notices on the 17th or the 18th, I truly believe it's going to be resolved, but that could I mean, if you receive that notice of discontinuation of services, you've got to make some plans. And whether that it could be severe for some people and others, I hate to see that happen if it never comes to pass. The issue that I would have with waiting or not continuing all the programs is, and Mr. Bass can maybe help us out with that, but you talked about the JARC program. If you discontinue the portion that you mentioned, you're not necessarily discontinuing equivalent expenses, because that program provides those services. I mean, you may have different people riding on the same vehicle, so the vehicle's going to go down the road. If you don't stop and pick them up,
Right.
your expense is going to be the same.
Right.
And you will have eliminated somebody's ability to be employed.
Correct.
Which, you know, if we're going back evaluating the programs, another different thing, but I'm not sure how easy it is to pick and choose the things that you want to fund. The other question that I would have about the WIC program through the Health Alliance, is that like the other things that we're discussing? There is an assumption that will be reimbursed if you continue to issue the vouchers like you have been, 71,000 or 77,000. 77,000, is there an expectation that you think that will be reimbursed by the federal government? Or do you have a track record in the past? Or?
The first notification that we received about the WIC program was that the state had funds set aside that they had been saving for some particular project, and they felt like they could support all the counties in the state through October 31st to pay for the expenses. Now, that doesn't relate anything to the value of the issuance of the vouchers, so I don't want to get those confused. What I do understand is that if they determine that they will not continue the program, I mean, there's no need for anybody to be there. We wouldn't even ask for you to fund them for them to be there. There's nothing to give them.
Right.
So we're just trying to monitor and see if they're going to put it back into place and let us continue, or if they're going to just discontinue the program until further notice. So I really don't have anything we don't know anything. I mean,
right. Well, and the reason that I ask those questions is some of the things that I have read is said, well, these people can go and apply for food stamps.
Yeah.
And knowing the issues that we're dealing with on that front, yeah, I mean, I received a call from somebody yesterday that had applied for recertification in June. I think everything has been resolved now, but if that's not going to help, if we're talking, you know, and the conversations that I've heard is formula for babies and food and those kind of things, that's not something you can postpone for 4 months. I may be able to, but I could miss several meals and it wouldn't be a problem, but that's not true with most folks.
Our referrals for our patients, our clients, has been to go to the food banks, and then we've also dispersed information about giving everyone opportunity to contribute to the food banks to help support this.
Well,
We've
I'd
not
like
referred
to-
anyone to food
I'd
stamps.
like to throw a shout out to our staff. They have taken an initiative to actually raise baby formula and we have a local food bank within our department that we shared with CCM, and they're taking an initiative to help out there too. So just a kudos to our staff who recognize that very problem as well.
And that's great to hear, because they understand these situations and see these families daily. I guess my point is, you know, it might be a good risk for us to invest some money in that program if we feel that we will be reimbursed, to avoid compounding and creating additional problems on the other end. And I'm trying to understand all this and having limited success.
Well, I think the issue that you're seeing in the WIC, we're kind of seeing that on the DSS side as well. The information flow from Raleigh is very poor. We've been told since Monday we were going to have something more in writing from the Division of Social Services on a couple of our issues. We have yet to see it. And today, or late yesterday, we learned about the Work First situation. We're told we're going to have a letter today. Unless it's come through in the last few minutes, we have yet to see it. And there seems to be a disconnect at times with the communication. we're like you, we're struggling to try to provide services and be as efficient as we can while balancing the impacts of the loss in funding, and it's just, the lack of information has been a little frustrating. It sounds like you all are experiencing the same thing on the health side.
Well, it's kind of interesting. The only thing that we have received confirmation on is our grant from DSS that said it's not a problem.
Let me see if I can make a sort of a compromise motion, which is, previously I had said let's fund through the 18th and send termination letters for the 18th. We have got a meeting on the 21st, and so my expectation is if things work out perfectly, things will be resolved on the 17th, and we'll have our meeting on the 21st, and that'll be that. I move that I would like to make a motion that we fund all of these programs through Tuesday, the 22nd, that termination letters be sent for all of these programs for Tuesday, the 22nd, with the understanding that the programs will likely be restored on the 17th, and if they are not restored, then we have the opportunity at our Monday, the 21st meeting to decide amongst these programs which one we are going to continue to fund at that point when it looks like potentially long-term a shutdown.
That includes WIC?
That includes WIC, yes, sir.
Okay, so we'll need to
The WIC issue, I think, I'll let Tammy elaborate on that, but it's not the staffing that she's not getting money for. It's the vouchers,
Right, so
and
it
unless
won't
we
help.
cut a check to the federal government to make those vouchers active,
Right,
I don't know how we can resolve that problem.
right.
Yeah, the way I understand it is that the state has promised that we are going to be funded through the end of October. Now, of course, that would mean that any staff that, well, no, that's going to be a November payment. So, I mean, I think we're good through October 31st. It's the funds that they, or the funds that they have stopped for the issuance of the vouchers, and they're not going to go retro. And if you only get 10 days' worth, that's all you're going to get. They're not going to go back and give them the full value if they had picked them up on this day or the next day. At this time, and I know this is very hard to believe, I'm not asking for any money.
Right.
Well, that answers that. Great.
Thanks. Make us look real good up here.
Okay, Ben, just to make sure we have it clarified, well, we don't have a second, so if you guys want a second, then we'll discuss it real quick.
I'll second that, and, I do believe that probably an agreement will be reached before, certainly by the end of the month, I would hope. But, I do agree that by the 21st, our meeting on the 21st, we need to really be making some serious decisions because the debt ceiling debate's going to be one in itself. So this has multiple facets to this issue, the shutdown, the debt ceiling, and I think that if something's not resolved by the 17th, on our meeting on the 21st, we're going to have to make some serious decisions, and I'm not sure that we should go through and choose which programs. I think it should just be a suspension of all the programs that we're putting money into locally if something's not reached by our 21st meeting.
Work first.
Well, for clarification, there are certain services that are covered by these funds we cannot suspend. So I think when you talk about terminating services, am I to assume you're talking about direct service to clients, such as child care, such as a transportation service, home and care community block grant, child protective services, adult, we can't suspend those. The only options we would have there that would, again, be something I would prefer not to do, but again, we're here to work with you, is potential furloughs within those areas, but, that would be, we really want to be careful with that because we have to, if we get a report of a child abuse, we have to be out there in 24 hours. We can't. So that's
right.
So maybe some clarification on child care, transportation. We probably would need a little more clarification.
I think what Mr. Osterreich's motion was for the programs we're talking about tonight, we'll continue business as usual.
Okay.
So those are the only ones we're talking about. The other ones are going to continue business as usual.
Okay.
Through the 21st. Hopefully it'll be fixed. Now, what impact does this have on Work First?
Work First
We still have to do what
we still have to
proposed.
do that because the state has suspended Work First. So we still need guidance on, can we reallocate those workers? If this gets resolved tomorrow, then, we won't be there. But if come Monday morning at 8 a.m., we still do not have resolution, we have to do something with those 4 workers. So would we reallocate them or would we furlough? we still need guidance on that.
And that was the initial request. Mr. Rose is recommending that the 4 staff people in that program be reallocated to another program that is still functioning, and we would receive, it would be 50% local money versus, and 50% federal money, but that money is still flowing. Currently, it's 100% county money, so it is a little better deal if we, at 50-50, if we can keep them on through the 22nd as well, and then make that decision then.
I think since it's, 50-50, I can agree to that until the 21st, but I think on the 21st, we need to be prepared to make some serious decisions, which, hopefully we won't get to that point, but I think we all need to come to that meeting prepared if there's, if this shutdown's still going on.
Well, what we can do is we can have some contingency plans. We can work with our HR department and have contingency plans to deal with those very issues. And so if we are there at your meeting on the 22nd, we can maybe have some proposals that would, if it involves furloughs, so be it. Our staff, we've had communications with our staff.
Right.
They are aware of the situation. They're very understanding. And we just, they know what we're in. So.
Well, and, there's only so much we can do. It's a really unfortunate situation, but, we can't always just step in for the federal government if they're not going to, reach some sort of deal soon. I mean, it's not fair to us, and it's not fair, it's not fair to anyone. And, it really puts us in a position, and, it's like we're having to step in for the federal government and do their job, and that's not what we're here to do. So hopefully this will be resolved by the 21st.
Do we need that in a formal motion, do you think, or?
Yeah, I would.
Okay,
Yeah, I would do that.
Jason made a motion. Is there did you second it? Okay. Larry?
It's okay
Do you want to
with
say
me.
anything?
It's okay with me. Do it.
Okay. So your motion is, well, the 22nd, as stated, on that the 22nd would be when it would take effect, or through the 22nd?
We would fund through the 21st, through our meeting, with termination letters being sent for all services that we can terminate. Any service that we have discretion for, a termination letter being sent, notifying them that their services will be terminated on the 22nd. And with the hope that none of those services are terminated, and then also giving us the opportunity to determine which of any, to accommodate Commissioner Mismer, services we would like to fund after that date.
I think my suggestion to fund through the end of October, is basically to provide stability for these folks so that they know what's going on to the end of the month. What I just heard you say is on the 21st, services will be terminated on the 22nd. That concerns me a great deal. So you're talking about people that are planning on going to work the next day and taking their children to daycare, and you're going to tell them on the night of the 21st, that ends today. I would prefer to see us extend to the end of October. Once again, hoping it's resolved and it doesn't have an impact on us. And then on the 21st, we're talking about 10 days from now. On the 21st, if it has not been resolved and we've passed that debt ceiling deadline, then make a decision as to what will happen on November the 1st. At least that gives folks, about 10 days to make arrangements as to how they're going to handle the situation. If we're going to give them 1 day's notice of termination, I'd rather give them 10 days now.
Well, that's what we're putting the 10-day notice today, that if a deal's not reached, then services are going to be suspended.
Well, that's not what I'm hearing. I'm hearing that in 10 days, we're going to talk about which services might be suspended and might be not. So for people, just to use the daycare as an example, they say, well, maybe they'll extend it for 10 more months. Maybe they won't. I'd rather be more specific you're safe.
Well, I think with the conversation is that, after the 21st, we won't be able to go forward. So,
Well, I
I say
think we are able to go forward if we
Wow.
choose.
if we choose, but that's taking a very big risk. So that's where today we're putting on notice that if a deal is not reached, then we're going to have to there's going to be a lot of consequences.
Right.
So.
There are going to be a lot of consequences, and a lot of the consequences are going to be ours. Because then we've got on the other side of the program, then we've got to deal with these service recipients who are going to increase in number on the food stamp side, other services, and I'm sure you folks can elaborate what impact might be. But if we do that, and then it's resolved, then we have created a huge expense for ourselves that we could have avoided by just sitting tight a little bit.
Are the food stamp funds still been funded?
Currently,
So they're not messing with them at all?
Not at this point, no.
Food
I
stamps
didn't
and
think it
Medicaid are
would.
still flowing.
I appreciate your concern, Commissioner Morris. I see your point. But let's take a step back. This is an agreement that our citizens have with the federal government. It's not an agreement that they have with us. It's an agreement that they have with the federal government. The federal government, as far as I'm concerned, has abandoned them at this point. And what the federal government has left them with is Mr. Rose shutting down their service maybe today. That's the notice that they would get, but for us stepping in and doing this additional service for them. And so I appreciate the fact that they may not get as much notice as they like, or as much notice as would be optimal, but they're getting tremendously more notice than what they would get, than what they are getting from the federal government. We are stepping in and really throwing them a lifeline. And it may not be the most preferable lifeline. If I was running this program, I'd run it a lot differently. If you were running this program, you would run it a lot differently. But this is really a tremendous lifeline. And when you throw a lifeline, it's not always perfect, but this is we are giving the clients of these services a much greater benefit at this point than the federal government is giving them, and we have to compromise. I mean, part of that is we have to take our taxpayers into concern, and we have to take these service recipients into concern. And I feel like that this is a compromise of both of those two concerns to say, we are going to fund this out, we're going to give you the certainty that you have the next 10 days of it, but after that, that's all the certainty that we can give you. And I do feel like, as of the 17th, if there's no agreement on the 17th, then probably most of these service recipients should understand that they may not be getting services after the 22nd. My suspicion is that there will be an agreement on the 17th and that they'll still have in another 5 days. I mean, one of the benefits, I think, of this, it does give them 5 more days. I think on the 18th, that was cutting it very close, but this gives them 5 more days to get their services figured out and things like that. And I understand it's not perfect. We're not in a perfect situation. This is really not our program, and we are just trying to throw the best lifeline that we can throw to them. And I do feel comfortable with that notice.
It's a temporary help.
Yeah.
Yeah, and I don't think that is the best lifeline that we can throw. I think we can throw a better lifeline, and I don't think it will cost us anything. I think that we run the risk of it costing us significantly if we don't extend it out, should that happen. So, please.
Well, I would just, I think y'all have challenging decisions, and we're just administrators, so we try to just administrate the program effectively. I think the one area of concern about that I would have with total suspension of daycare would be that we do have some families in there that are child protective services and foster care. I would have concerns about displacing those services. Number one, because with foster care, we're going to pay for it anyway. We would have to provide that service. So we would just be taking county dollars to pay the foster care child care bill for the child that's in with the foster parent that may work. And then on the second side, the families that are in-home services that are kind of at risk with at-risk children, sometimes that daycare is the best place for that child at that time, and it's a supportive service that if we lose that service for that child, they could easily come into foster care. Not saying they would, but that's just a potential ripple effect of that. So I think ideally, you know, instead of total suspension of daycare, if we have to suspend daycare, I think we would probably recommend if we could at least keep providing services to those children, and that's a much reduced cost. I think the cost is, I think they calculated it about $84,000 per month. That, I think, could potentially save us, and again, this is an assumption that it draws out, that could potentially save us if we have to take kids into custody, or if we have to turn around and write a check because the child's in foster. When the child's in foster care, we're the guardian. We have the responsibility for their care, and some foster parents do work. They don't have the requirement to stay at home. So we are providing that service with these federal funds typically. So that could be something I would maybe ask for you to consider on the 21st or 22nd when you meet as well, too, or 21st when you would meet. So I think, you know, if that could be something that could be factored in as well, too.
Can I interject? I'm sorry. Two things. We will add to our agenda on the 21st, this item, okay, because that's what it's already been determined. It'll go on the agenda. We do have a line for old business, don't we? We'll put it under old business. And then, I know, we don't usually have things under old business, but.
No, we're looking at the picture.
Oh, good picture, Megan, thanks. So we will add that, and all of these other discussions will be, we'll rehash this one more time then. Okay, second thing, in your motion, just for my clarity, are you including moving the 4 staff members from work first? Is that part of your motion?
Yes, it is.
Okay, I just
Yes.
wanted to make sure, because I wasn't 100% certain that that was in there to begin with when you restated it, so I wanted to make sure of that.
You know, I'd like to revise my motion to, instead of being the 22nd, be the 23rd. Our meeting is in the evening, and if we do provide additional, if we come back, as Mr. Rose had suggested, and provide certain services for people, that will give them the ability to have a work day to understand that, otherwise they're not going to know what's going on at that night. So fund through the 23rd. I'm sorry, through the 22nd, with services terminating on the 23rd.
Okay. Are you okay with the 23rd? Larry, you said 23rd.
Yeah, I'm okay with it.
Chris, you said 22nd. Are you okay with 23rd? Okay. I will vote against the motion because I'm with Steve. I think we should go through the end of the month. And I don't think that few number of days is going to be harmful to us. So I'll call the question. So all those in favor of the motion, say aye.
Aye.
All those opposed? No. Motion carries 3-2. Okay.
If I might, Madam Chairman, I wanted to ask one more question. On the child care issue, is it my understanding correct that some of these daycare centers have sufficient numbers of these clients that if you eliminate them, they may shut down completely? That it will leave them with, that's the impression that I've gotten. So which means these foster children and other people will have to be relocated to a different care provider?
I would probably defer that if it's okay to Ann Benfield. She's more the expert on the provider side, and Ann is here. So Ann might want to maybe address that.
Thank you for the opportunity, and thank you for bringing that up. I think everybody needs to remember here that child care owners are small business owners in the community, and we have looked at the high rate of child care subsidy in the county, and if anywhere from 25% to 100% are some of the child care centers, they would have to shut down, which would definitely impact the children that are private pay and do pay fully. So if you do enact this prematurely and parents don't know what's going to happen, yes, definitely, even though you think you're only affecting the subsidized children, you're going to be affecting a lot of other families in the community that want to private pay, but their child care provider cannot afford to stay open.
Which impacts our employment numbers and makes the whole picture even larger.
But that's a decision made by that business owner to have majority of their business subsidized by the government. And if they choose to make that decision and we take those subsidies away, that was their decision. They knew that that was a potential. And if my child was going to go to a daycare, that may be a question I would ask is, what's, maybe the business model. If majority of their income's coming from government subsidies, I would probably take my child somewhere else. It's a business decision made upon that facility, and if the subsidies are cut off, it's unfortunate, but the government can't continue subsidizing.
Sometimes that's a choice that the family has to make because that's the only place they can afford. For example, the Logan Community Child Care Center, which will be shut down because they serve almost 100% subsidized children because that's the community that they serve. And yes, it is a choice because that's one of the child care centers in the county that provide whatever the market rate pays by the state for child care subsidy. There's no copay because the families can't afford to pay that either if they're working and trying to support the families that they have. So yes, that's a choice that some people make to work to provide for their families. Not everybody in the Cabarrus County is as lucky enough to make the choices that you would be able to make. But there are working families in the community that are trying very hard.
I certainly understand that, and I applaud their efforts. It's just unfortunate.
Exactly.
Thank you, Ann.
Okay, the next item we have, I'd like to thank all of you that are here.
Thank you. Thank you for your tough decisions.
We just wasted an hour and a half over nothing.
The next item we have is concerning finance and the budget.
Yeah, we're going to do it.
Settle by Monday.
Yeah. let's
Can we take a brief, go ahead and do our break at this time,
I hope you're right.
please?
The